Hey you guys, welcome to my channel, Well with Anika. My name is Anika, and it has been about 7 months since I had my hysterectomy, and I thought I'd come on and just share with you guys a couple of postmenopausal must-haves, right? Here's just a little checklist of postmenopausal must-haves that I feel like I cannot live without, that are really helping me with my menopause journey. May, I had a hysterectomy. I had everything taken out, my cervix, my ovaries, my uterus, and my recovery, I feel like it went really well. I did have an issue with an ongoing bladder infection that I believe I got during surgery. If you are interested in finding out how that all went and how I came out on the end of that, I have a series on my UTI journey. So I'm not going to go into that too much here. I do want to talk to you guys about some things that I am using on a regular basis to just kind of help me get through the menopause journey. Some of them are prescription medications, and some of them are supplements that I feel like support me in my health along the way. First, I'm going to start with prescription medications. I opted for estrogen hormonal replacement therapy. So I opted for estrogen patches. There are a ton of ways that you can get estrogen in your system, from creams to sprays to patches to pills, but I opted for the patch. I am currently on a 0.075 patch. I started out with a 0.05 milligrams, and it's a patch that I change. It's twice weekly. And so I change it every 3 days or so, sometimes every 4 days if I forget. And I just stick it right on my abdomen where my ovaries would have been or were. And so I just switch from one side to another. You can also wear them on your backside, but I choose not to because I feel like I'm more aware of pulling my underwear and my pants up and down if it's in the front. I'm too afraid of pulling my pants down or my underwear down and actually making it slide off. I've only had one come off one time in the shower. And I think it was because, first of all, I didn't have it on good enough. I put it on like before I got in the shower, which was really weird. So I feel like it wasn't adhered to my skin really well. And so it was a wasted patch. Totally fine. I just grabbed another one. And it was right around the time that I was switching from milligrams, from 1 milligram to another. So I put another one on. I imagine that if you end up messing up a patch, you just need to call your doctor so they can approve your prescription to be filled sooner than the regular time. So you'll have that extra patch if you just so happen to waste one or two. If that doesn't work for you, I said there's other options. You have creams, gels, pills, and things of that sort. I didn't have any pre-existing conditions or wasn't predisposed to any type of cancers, blood clots, or anything like that. Systemic estrogen, bioidentical estrogen patch works really well for me. There are some studies that show that wearing a patch is better if you have blood clots or something like that. Not to take the pill, but that's what I chose. The second thing that I have is an estradiol vaginal cream. And my doctor and I discussed using the cream to see if it would maybe help with my TI issues that I was having. I thought maybe this will be a good additive to see if I can support my vaginal canal along with my urinary tract and the urethra and all the tissues down there by using a vaginal cream. I feel like it's been instrumental with that, but it's also been instrumental in helping with, I'm not going to say necessarily libido, but just enjoying intercourse more. It has been very instrumental in really having the blood flow and being sensitive in that area. Vaginal estradiol cream is really good for helping that tissue down there to flourish, stay pliable, and moisturize. Helps with vaginal dryness and all the things. It's not going to help so much with like hot flashes and osteoporosis or any other symptoms of low to no estrogen, but it will help with that whole vaginal area and urethra bladder area by using the estradiol cream. I have a 0.01, if you can see that, 0.01 cream. I started out using it every night for 7 days and then just once a week after that. So sometimes I don't always use it once a week, but I try to stay consistent and not go any more than 2 weeks without using it. I do it at night. It puts you in the mind of how you would take a cream for a yeast infection. It has a little applicator where you draw up so much that the doctor tells you. Mine is to the 1 milligram line, and then you insert it in the canal and press the applicator, and it shoots the cream up there. I have followed many a doctor and gynecologist, and they also say that take some of that same cream and rub it on the outer parts and inner labia and outside the vaginal canal, and that it really helps those tissues. And like I said, I believe it really does. I am happy with this as well. The third thing that I use, and I've actually been using this prior to, let me see, make sure it doesn't have my address on here. I've been using this prior to actually having surgery, and it is testosterone cream, right? This is a compounded testosterone. It comes from Biomed Pharmacy, which is about an hour from here in Cincinnati. I'm in Ohio. And so it's about an hour from me. My doctor called it in. I actually just went up on milligrams. She does test my testosterone levels to see where and if this is actually making them rise. And I had went from 1 milligram, 2 milligrams. Now my new prescription is going to be 4 milligrams because we're trying to get my testosterone to rise. What I feel, even though my testosterone numbers haven't moved much, I do feel it has helped me with libido, for sure. I do feel it has helped me with blood flow in my personal areas, and I feel like it has helped me have more clarity. All of these have helped me have more clarity. Like this is that brain fog, just that not feeling like doing anything, not sleeping, hot flashes, all the typical things that come along with menopause. These three right here have been a game changer with kind of resetting that to where I have libido. I'm in a better mood. My vaginal area is not dry and irritated. My UTIs have subsided. I'm getting better sleep. I'm not having a whole lot of hot flashes. Every now and then I'll get a little warm, but not to the point where I'm breaking a sweat and can't think because these hot flashes are so intense. Those three have really been a game changer in helping me with all of those symptoms just by replacing what I'm missing, basically. I've had estrogen all of my life, and now all of a sudden it's gone, completely zeroed out. Adding what I've been missing back in has been a game changer for me feeling more like myself. This prescription right here is something that I just added, and I had talked to my nurse practitioner about this one. This is a micronized progesterone, 100 milligrams. Now, it is thought that women who do not have a uterus would not need to have micronized progesterone or any type of progesterone because progesterone is really supposed to be for women who have uteruses, or if you're still planning on having a baby, you really need that progesterone, right? Because the higher your progesterone, the more probability it is for you to carry a baby. But as you get older, of course, that diminishes like all the other hormones do. And progesterone really helps to keep the uterus nice, happy, and healthy. Women who still have a uterus and who are taking estrogen have to take progesterone because it helps to protect the lining of the uterus from cancer. Well, I don't have a uterus anymore. I don't have ovaries and I don't have a cervix. Why am I taking progesterone? Well, my thought is, isn't progesterone something that my body utilized before all of this happened? It's something that my body needed, not just to protect my uterus, but to help with my bones, my mental clarity. And as I'm reading more and more about progesterone in the body, it helps with the microbiota in the gut. For a while there, I was having a lot of issues with going to the bathroom and just having normal bowel movements to where it was comfortable. I was bordering constipation, going longer without trips to the restroom. And then when I did go, it would be hard and dry. And I'm like, something is up here. As time is going on, I'm replacing all of my hormones. What's happening? And so I started to look into progesterone. And why am I not taking progesterone? Because I hear about how you have wonderful sleep. It's more of a deep sleep, a more restorative sleep. And then how it helps with the microbiota in the gut to help with the pre and probiotics that keep the gut friendly and happy and healthy and moving, right? And so I asked my nurse practitioner about it, and she was like, she's really into holistic modalities anyway. And she was all on board. She said, yes, she believes that that's something that I would benefit from. We can do a lower milligram. Normally for women who have a uterus, she does 200 milligrams. She said, we'll start low. We'll do 100 milligrams and to see how that goes. What I do with this is I take this about 3 times a week. I don't take it every day. I do about 3 times a week. I take it in the evening time before bed at around 9 o'clock because it does make me sleepy. Progesterone will make you sleepy. And I have noticed that it is a more restorative, deeper sleep. Even when wearing my Fitbit, it tells me that I'm in deep sleep even more. That has really been a game changer with waking up, feeling more alive and alert. I really feel the progesterone is helping so far. These are my 4 staples when it comes to really helping with my health. These are my 4 prescription staples. It's micronized progesterone. I do that 3 times a week. You have to figure out how to do it for you. I do testosterone. My doctor did test my testosterone levels prior to even starting a topical cream. It is a compounded cream that we order from a compounding pharmacy. My insurance does not pay for this and will not pay for it. So I have to pay out of pocket. I pay about $65 to get this particular cream in the mail. And that's about once every 45 days or so. It's a 30-day supply, but I guess I'm not using it as every day like I should. I take a break on like Sunday, sometimes on the weekend, but at least 5 days a week I'm using my testosterone cream. You may want to ask your doctor about that. The vaginal cream is, like I said, it goes in the vaginal canal. You can actually take some of the cream and rub it in the labia area, around the clitoral area, outside the actual vaginal canal to help with the tissues in that area. I feel like it has helped me with that and sensation and having more enjoyable intercourse with my husband. And then I'm doing the estradiol patch. I have 0.075. I started out with 0.05 and I felt within, I know, a good 3 days, I started to feel an improvement with my hot flashes. Now that time has gone on because I've been on the patch, and this is the first thing that I started with. Like I said, I was doing testosterone cream even before my surgery, but the first estrogen product that I started with, even now, 6-7 months later, I just feel so much better. I feel so much more alive. I feel so much more balanced in just who I am and in my body. I'm not going to say I feel like I did in my 30s, but I definitely feel better than I have in a long time, because I feel like the last 2 to 3 years have been rough. I turned 50 in July, and I feel like after having surgery, there was just not a really good bounce back after that surgery. Having these 4 prescriptions on board have really been a game changer. I recommend that you ask your doctor about it and just to look at your family history. I understand everybody is not a candidate for hormone replacement therapy, but I believe that it is worth the conversation with your doctor. And if your doctor doesn't want to hear about it, I suggest that you try to find one of the online telehealth doctors that are helping a lot of women be able to get back to just living life. There's one book that I recommend, and I don't have it here in front of me. Hold on. All right. This book has been a game changer for me. It's called The New Menopause. It's by Dr. Mary Claire Haver. And she is the maker of the Galveston diet. She also has other supplements and things, online for sale. But her book has been a wealth of information just to help me understand how hormone replacement therapy started, and then to understand what some of the symptoms are of menopause. And I was flabbergasted to just learn that there were so many symptoms with very little support. And here's a list of those symptoms. And what's highlighted in pink are all the ones that I felt like I suffered from, which is crazy. And just to think back, like in my late 30s, that I was kind of dealing with some of these things even back then. So And just learning that menopause can start as early as 35, right? And that you can have perimenopausal, symptoms all the way up into your mid 50s before you actually go into menopause. And so it was just crazy to just kind of understand that where a lot of my issues were coming from. Because I'll never forget back in my 30s, and it was when I was pregnant with my son, about 30, 35, 36 years old. And before I got pregnant with him, I started having issues with acid reflux. Acid reflux is one of those issues that is a result of low estrogen, right? Dry, itchy eyes, dry mouth, dry skin, eczema, decreased desire in sex, memory issues, menstrual cycle changes. And that's menstrual cycle changes was one of the things that was really bad towards the end before I had my surgery. Sleep disturbances, incontinence, heart palpitations. I'll never forget 2017, I started having heart palpitations and went to the doctor, spent the night in the hospital, hooked up to a monitor so they can try to see why I was having heart palpitations. In 2017, that was just 7 years ago. I was 43 years old, probably perimenopause, I'm sure. Fatigue, incontinence, brain fog, irritability, weight gain, wrinkles, body odor, brittle nails, bloating. I used to always have really nice nails. Now my nails split, well, they're better now that I'm on estrogen, but my nails have started to split and not grow and become very dry. And just, bloating, body composition changes, belly fat. I've always been small all my life, more slim, slender, and tall, long legs. And now I have this, tire around my midsection, and it started about 5 or 6 years ago. So just to learn all of those different things that are contributed to menopause was very, very interesting. So this video went a lot longer than I thought. So I think I'm going to stop right here and just dub this as the prescription medicines that I use to help with menopause. And then I'll do another video with some of the over-the-counter supplements that I use to help me manage my menopause symptoms and to support my body overall. If you enjoyed this video, take some time and share it to one of your other menopause sister friends, right? Some of your family members that may be going through menopause. Like and subscribe to the channel if you're interested in more menopause content. And until next time, be well.